what are the lenses made out of? Most of the time, our intraocular lenses, particularly our premium lenses, are made out of acrylic, which is a type of plastic. There are two types of acrylic. There's hydrophobic acrylic, and that's the more common type. Hydrophobic means that the fluids that bathe the lens and the proteins and the minerals are gonna, not, so they're repelled by the lens, so they're not gonna get into the lens. And then there's another material called hydrophilic acrylic. And typically the hydrophilic acrylic is just like the outer coating's hydrophilic acrylic, and then the inner coating is hydrophobic. There's some kind of dual layer, but those are less common. And in the past, it was thought that some of the proteins, minerals can get into the interface between these two materials and cause glistenings or opacification in the lens. You hardly ever see that anymore, even after decades and decades of use. But I think because of that, many decades ago, they decided that that wasn't a good material to use. So nowadays, most of the common American lenses are hydrophobic acrylic. You also have other materials, older materials such as PMMA. It's a very hard plastic. It doesn't fold, so you have to make a huge incision and slip in the 6mm lens. To my knowledge nowadays, that doesn't exist anyway. Everybody uses a 2mm incision, a foldable lens. And another very common material is silicon. Silicon it's a great optic. The light adjustable lens is silicon. Very, very good quality optic. The issue with silicon is sometimes it can cause you to have early posterior capsular opacification. We see that a lot with the light adjustable lenses. Sometimes within like 2 or 3 months, you have the opacity already forming behind the lens. Silicon, other issues. It's very soft. So when you go to YAG, do the YAG capsulotomy, sometimes it can pit in, where you're shooting the YAG. I think for those reasons, silicon's also out of favor. The light adjustable lens obviously needs silicon because it's very pliable, because you're going to change the shape of the lens with adjustments. But there's few other lenses. Bausch & Lomb may have a silicon 3-piece lens, which some people really like. Yeah, but those are the main materials. We should also take some time to talk about the ICL material. So it's a collar material. It's kind of like a hydrogel, just kind of like a contact lens. I think it's a really good material. I don't know why it's not used more in intraocular lenses and more so just ICLs, but maybe in the future. It's very soft, so maybe if you put it in the capsular bag and the capsular bag shrinks around, it's too soft that it can warp the shape of the lens as the scar tissue builds around it or something. But very, very pristine optics on that lens, very thin material, just like a contact lens. Nothing ever grows on it. You never see any cells or opacification on that thing. It never scars into the tissue, which is just amazing. But very interesting. ICLs are a very, very good surgery and very good lens. So sorry, I almost didn't mention